Now, let's look at how to perform a cholesterol blood measurement using the Accutrend Plus. To perform a glucose test, you follow the same simple steps using the Accutrend glucose test strip. For additional information on performing a glucose test, please refer to the user's manual. In this section, we will show the testing procedure in a professional environment. Please follow your facility's guidelines for protection against infection and contamination. To perform a test, you'll need the following items: the Cobas Accutrend Plus meter, a Cobas Accutrend cholesterol test strip, an Accucheck Safety Pro Lancet, alcohol wipe and cotton ball. Power the meter on. The meter displays a flashing strip icon and a test parameter code number. Before performing the measurement, make sure the meter shows today's date and the correct time. Check that the battery symbol is not visible. If you see the battery symbol, you can only perform a few more measurements, so replace the batteries as soon as possible. Remove a test strip from the container and close the cap tightly. Test strips are sensitive to humidity. Also, do not touch the test strip with wet hands or wet gloves, as this may damage it. With the measurement chamber flap closed, insert the test strip smoothly into the test strip guide with the application area facing up, in the direction of the arrows, as far as it goes. The meter beeps twice and the display changes to the test display, and a flashing arrow instructs you to open the measurement chamber flap to apply the blood. Open the measurement chamber flap. It will lock in the vertical position. A flashing blood drop appears, and you can now collect and apply the blood sample. Blood can be applied to the test strip while in the meter or outside the meter. In a professional environment, Roche recommends applying the blood outside the meter. Remove the test strip. Perform the finger stick. For the cholesterol test, wipe away the first drop of blood. Once you have a second large hanging drop of blood, apply it immediately to the yellow sample application area on the test strip. Be careful not to touch the application area with the patient's skin. The yellow application area must be completely covered in blood. If too little blood is applied, do not spread it or apply a second drop. This may cause a false measurement. If necessary, repeat the test with a new strip. Insert the strip back into the meter and close the measurement chamber flap. A countdown appears and the blood test begins. A cholesterol test takes 180 seconds. A glucose test takes 12 seconds. The meter counts down to 0 and the result appears on the display. Record the result according to your facility's guidelines. The result is also stored in memory. The Cobas Accutrend Plus meter automatically stores up to 100 results with the date, time, and event flags in its memory for each test parameter, 200 in total. For more information on reviewing results and event flags, refer to the user's manual. Remove and discard the test strip and lancet device according to your facility's infection control guidelines. If you would like to perform a glucose test for the same patient, lance a different finger for the second test. Once you are finished, power the meter off. If the meter displays an error message rather than a test result, refer to the error messages section of the user's manual to learn what to do next.